This is Betsy Jensen, and you are listening to Unstoppable Body and Mind, episode 134, Stress, the Subconscious, and Pain, an interview with Jim Prussack, the Pain PT.
In this podcast, we learn to upgrade our brain and understand the power of our thoughts, to heal and to create the results we want in our life. Become the person in control of your healing and make peace with your life. Become unstoppable, body and mind.
Hey everyone, welcome. Today we have a special guest, Jim Prussack, the Pain PT. I met him over in Boulder. We were at a conference together with a bunch of basically celebrities in this world, Dr. Schubiner and Charlie Merrill was another PT. And I invited a lot of people to be on my podcast and to interview and just get a lot of perspectives. And especially, I love hearing from other PTs. I haven't had another PT. Never mind. I've had one other PT on the podcast. It's been a while, but we had never met in person. So thanks for being willing to come on and just do this off the cuff.
Yeah, no, I appreciate it. I know we talked in Boulder, and we're both from the physical therapy background. So I was excited to come on and chat with you about all stuff, mind, body.
Yeah. So I remember starting this work around 2020, and I think you were already making some YouTube videos and stuff. So could you just fill us in on how you evolved from being a PT to the work you do now?
Yeah, I get that question a lot. Well, like you, traditional PT school, graduated in the late 1998, I think it was, and started worked in outpatient orthopedics primarily, sports medicine. Was starting to see a lot of workers' comp patients as well. And I was starting to see people where they weren't getting better. I'd been doing a lot of continuing education, a lot of manual therapy, a lot of just learning as much as I could to try to help people. And I just started seeing people not get better with the stuff I was using. And I started wondering what was going on. So I decided at that time to go to Australia to do a postgraduate master's in manual therapy. So I thought maybe I can learn more, some more advanced techniques. And what happened was, long story short, is I came back home learning much more about pain science. And one of the classes we took was neuroscience or pain science. And so I learned a lot about chronic pain. And at the time I was doing research as part of my degree with Peter O'Sullivan, who is a PT in Western Australia.
Oh.
Many of you probably not have heard of that name. You may have heard of Lorimer Moseley.
Yeah, I was expecting that name drop.
Yeah, he's really well known. But Peter, I would say he's equally well known. He deserves more credit. He's done a ton of research. But at the time, we were studying core stability. Mm-hmm. So we're looking at all these types of contractions of those muscles. And, he did so much research on that. And then he abandoned all of it. He literally, a few years later, said, the data is not really supporting what I'm seeing. And so he went on subsequent years.
If you get
core stability.
Then your back pain will decrease, and the research just wasn't showing it.
Yeah, his own data wasn't showing that, working on the core and strengthening your transverse abdominis, your multifidus, your back muscles, all these little muscles that they were trying to isolate, that it wasn't really having a big effect. So I give him a ton of credit. He sort of said, you know what? The data is not supporting this. We need to figure something out. And so he went on to start what's called cognitive functional therapy. Not sure if you know that. It's a bit in alignment with the mind-body work. So teaching the people, that their bodies aren't broken. Once you've checked things out, looking at their beliefs, looking at their fears, very much in alignment with the work that I was doing. But at the time, I didn't train with him on that, which is interesting. But I left Australia. I came back with an open eye to the pain science. And I was starting to get a lot of people now coming in where I could see it more clearly, but I still hadn't trained enough in it to really implement it. I was in a private practice. So I forget what year it was, but I actually reached out to Dr. Sarno. He was still practicing. And he just said, hey, there's a guy on the West Coast. I live in San Diego named Dr. Schechter, David Schechter.
Yeah.
Why don't you go talk to him? He trained. I said, okay.
Cool.
So I went over and met David Schechter for a day. He took me into his office. Got to see patients with him.
Nice.
And then from that point forward, that led me to Dr. Schubiner, who's another big name that you mentioned. And I ended up going out there pretty early days before he did a lot of his trainings. And I spent a whole week with him in his practice
Oh,
and got to shadow him with patients. He's such a great guy, as we all know. And
oh
he
man,
had
yeah.
me over for dinner at his house and showed me around. And he's just such a good guy. And so I learned a lot from him.
Yeah.
And then from that point on, I just did subsequent trainings. I trained in with Georgie Oldfield in the SERPA. I'm a SERPA practitioner in England.
Wow.
And then came back and did subsequent trainings with Alan Gordon,
Hmm.
Howard Schumer,
Yeah.
things like that. So it's been sort of an evolvement over time. I
Hmm.
gradually went from just doing straight up regular physical therapy to treating part time, these chronic conditions. And now I've been full time for I don't know how many years, maybe 4 or 5 years now.
Hmm.
Uh, just solely treating this type of stuff. And since
Yeah.
COVID, it's all gone virtual, as it is for
Yeah.
some people now.
Hmm. So you're coaching online, right? And are you incorporating much movement, like graded exposure and actually doing exercises, or is it mainly like coaching?
It's mainly coaching, but I absolutely do exposure training,
Hmm.
but not in a PT way.
Yeah.
I'll come in and use our PT knowledge to explain to somebody, but most of the work I do is not very specific or very technical. It's
Hmm.
more general, because what we're trying to do is promote safety in the person's body and brain. So
Hmm.
we're just trying to get them back to life mainly. We don't want to create more fear. We don't want to create more worry and focus on the body that something's wrong. Because
Hmm.
as you know, most of these conditions, there isn't really anything in the body anymore that we're particularly focusing on. It's more about the brain and nervous system.
Yeah. I've had that same kind of path, just totally switched over to coaching. Of course, there's some somatic work and visualizing and but not necessarily like do 3 sets of 10 of this exercise because we know that's really not going to get them out of pain.
Yeah, totally agree. It's really an interesting paradigm shift. I'm sure it is for you as it is for me, going from just a clearly physical biomedical approach, structural, could do these exercises and
Yeah.
to basically totally away from that, really just go, let's get back to what you want to do and,
Yeah.
start to teach your body that your body's strong and stable and it's not broken essentially. And that's really
Yeah.
the message I try to teach people.
How do you explain it to someone who doesn't understand or is new to it?
Yeah. So someone is new. I just explained it that look, we have a nervous system, autonomic nervous system that travels throughout your body all over the place, and it's controlled by your brain. And the brain is the master organ. So you have messages coming from your body to your brain and back from your brain to your body. And we have physical injuries, right? We have things that can happen to you physically, but those things heal. The body has a really natural, normal healing timeline. And so most things that are acute, subacute are going to heal. When they haven't, or maybe they have, or time has passed, you start asking questions. And those are the people I typically see are the people who don't have acute symptoms. They're chronic, lasting from various lengths of time. But usually after 6 months, most things in the body will have healed or healed up. So we start looking at things outside of just the body. We start asking questions about what's your, stressor, histories of stressors, some very simple questions like was there any stress or things happening at the time you developed these symptoms? What was going on in your life? You'd be surprised to find that usually there's something happening. There was some uptick in stress.
Hmm.
And then you can actually look further back. We can take it all the way back to childhood now that I look at and screen for adverse childhood experiences that many
Hmm.
people live through, other traumatic events, other periods of time where they had other somatic symptoms
Hmm.
that we can maybe relate also to periods of stress. So when we put the whole picture together,
Hmm.
family history, history of anxiety, depression. So I really want to get a really thorough exam.
Hmm.
Once I have that information, then I can explain it to the person or the patient what's happening. That this is a whole systematic thing, and if
Hmm.
you've been through a lot of treatments and you haven't gotten better, that's more information that is not in your body. The
Hmm.
brain can activate any symptom in your body through your nervous system.
Hmm.
So it can turn anything on and off. And if people are always complaining about tightness and tension, and
Hmm.
yeah, that is your brain. If it's not a local injury, that is your brain doing that. And that's why it doesn't go away when you do local treatments, because the brain just puts it back on again.
Yes.
You have to start looking at the brain now and say, why is it doing that? What's going on upstairs to be
Hmm.
causing this in your body?
Yeah. Yeah. Just the other day, I was driving. I think I was late for something, and I felt a muscle in my neck just start tightening up. And I wasn't doing anything crazy. I wasn't in an accident. I wasn't even really like turning my head aggressively, right? And then once I got home and I saw that I made it on time and I got on the call, and that muscle tension went back away. But yeah, our muscle or our brain can recreate any of those symptoms, the muscle pains and tensions, and even, what people say, nerve pains, and a variety of symptoms too, right? Like, tinnitus
Yeah,
and
what I've found is
headaches
it can
and
cause anything. And, I used to just,
anything.
as a PT, right, we treat this musculoskeletal ailments.
Yeah.
I treat everything now. So it's not just that. I treat IBS,
Hmm.
migraines, chronic fatigue,
Hmm.
you name it, all sorts of different conditions, fibromyalgia,
Yeah.
urinary bladder issues, uh,
Yes.
all sorts of different stuff that wouldn't be traditional physical therapy type stuff. But
Right.
when the brain and nervous system are the culprit, or they're the main causative factor, it broadens. It's like a huge umbrella of symptoms. It could be, as you probably see, anything in your body potentially could be caused by your brain and nervous system.
Yeah, yeah. And sometimes I think people have a tendency to think if it's a really bad pain, then that means that it's quote unquote a real pain, right? Like this got to be something structural because it's so severe and it's so widespread, or it's such a strong symptom. And I heard Charlie Merrill saying something like in his experience, most of those that are those 10 out of 10, 11 out of 10 pains, those are more likely to be the neuroplastic symptoms, the nervous system, as you said, like turned up, ratcheted up, um, sensitized. They call it with PT,
Sensitized, yeah,
central
that's the word.
sensitization. Yeah.
Yeah,
Yeah.
I know exactly. I see the same thing. Like it's outside the norm for what we see. The other reason we think of it not being the body, because there's a lot of emotion that people carry
Hmm.
with these conditions. It's not like, and you even might ask somebody, hey, yeah, I've had a sprained ankle. Oh, I had a shoulder surgery, but it
Hmm.
wasn't like this pain, right? So
Hmm.
a lot of people have been through physical pain, and it's
Hmm.
actually different. So this kind of symptoms they have a lot of emotion. There's a lot of stress around it.
Hmm.
It's not the same thing as your traditional physical type pain or injury.
Hmm. Yeah, and definitely the more that people have a story attached to it and relate it to, this is probably means I won't be able to walk ever again, and I probably won't be able to go to my daughter's wedding, right? And then it gets very emotional. And we know those parts of the brain do overlap. The area that interprets pain and emotion, those areas are the same type of neural circuits, the same circuits. They're, creating that same pain, a real physical pain. It's not a
Yeah.
made up pain.
That's
Yeah.
right. Yeah, it's a real pain, but the source of it is in the brain. And like you said, those areas overlap. We know the limbic brain, in particular, the amygdala, some of these other
Hmm.
areas of the brain are highly implicated in physical pain and
Hmm.
physical symptoms. And that's not something that we scan for. And I think that's the next evolution. I think personally that's going to happen is that we scan your back, we scan your leg for something. We don't scan your brain, and I think
Hmm.
eventually we'll start doing that and we'll be able to see some of these areas that are highly activated or underactivated. They've done a lot of research already. It's just not in mainstream medicine, but they've actually shown in some studies on chronic back pain, the transition from acute to chronic pain. They were able to predict by a brain scan at a levels pretty crazily 85 to 90%. They could predict from the scan at the time of the acute pain who was going to get chronic pain with an
Wow.
85 to 90% accuracy rate. So
Wow.
it's really powerful. It's just that it's not done in any clinical medicine. So we don't have that data. We're not factoring that in. Doctors aren't trained in
Hmm.
that. So I'm hoping that's going to change. Maybe, I don't know, a decade from now. Who knows how long it'll take.
Right. Yeah, just like you were saying, the brain shows these changes, and they've shown in the Boulder back pain study, the brain, they could show changes, I think just in 8 weeks, they
Yeah,
showed changes to reverse that in the brain too, right? So it's like
that's
it's
right.
this neuroplastic, it's always changing. And so sometimes people get really discouraged if they heard something like, oh, so I have now this problem with my brain, right? Now it's become chronic, and now I think they even did this study where people heard nails on a chalkboard, the sound, and people who had chronic pain, their whole system got activated. Many areas of their brain lit up, where another person, it might be slightly annoying, but it doesn't, get that level of activation. So,
That's right.
so seeing
Yeah,
like,
that's
oh,
right.
your brain is like that, but also these techniques, they're research proven techniques can reverse that, can calm that mind, can calm the nervous system back down.
Yeah. Yeah. It's just that the brain, look, it undergoes changes. We have to realize this is not saying it's all in your head or you're some crazy person. It's not that at all. If you've been through a lot of stress or you're under a lot of stress, it has to go somewhere. It's kind of common sense. It doesn't go out, shoot out your head. We're not aliens. We don't have antennas sticking out of our heads. It goes into your nerves. So
Mhm.
it's not far fetched, but I think what people don't believe is that stress can actually cause physical symptoms directly. We have this belief that yeah, it can maybe make it a little worse or it can amplify it, but it doesn't actually cause it directly. And I think that's where we need to have a new understanding that literally stress itself, emotion, stress can cause physical symptoms in your body. Very real, very debilitating. Sometimes 10 out of 10, 12 out of 10 send you to the emergency room. I've seen it
Mhm.
in many people.
Mhm.
So my mind was blown open from doing this work. And now I'm highly convinced it's because I've seen so many people experience this that it's incredible what you can have in your body and there be nothing wrong really in your body.
Yeah. Yeah. Do you have any examples that come to mind of something crazy that was
Yeah,
unusual?
gosh, let me see. There's lots of stories. I had a lady once in England who she had a severe sciatica pain, and it was started at work, sitting at her desk, and she'd been to a bunch of doctors. She actually at one point flew to the United States to New York to get a surgery to open her piriformis muscle because they thought it was pressing on the sciatic nerve. She
Mm,
got that done. Absolutely no change in her pain.
mm,
Nobody asked her any other questions about what happened. I started with the very basic physical question. Did you do anything at work to cause this? No, I was at work. Like I always was sitting at my desk. The pain just started one day. Okay. Nothing different. No, no. Anything else happening in your life around that time? Yeah. My father passed away suddenly 3 months prior,
mm,
and the pain started 3 weeks later.
mm,
Now, nobody had ever thought to ask her that question.
mhm,
And again, that's an emotional stress related event that then she developed the pain subsequently a few weeks later. And
mhm,
it did not go away through physical treatment. So
mhm,
things like that. I had a woman once get neck surgery before she knew this work. She actually had a cervical fusion done.
mm,
And when I got her history, she had absolutely zero neck pain prior. But what happened was during COVID, which was a highly stressful time, right, for many people, she developed COVID. She was terrified,
mhm,
scared to death that she was going to pass it on. Somebody was going to die. She started to develop neck pain, right, from the stress. She goes to the
mhm,
doctor. The doctor says, oh, your neck is just full of arthritis and degeneration. You need a neck fusion. So her not knowing this work, she said, oh my God, okay. So she gets a neck fusion, takes the pain away. Then she starts to develop knee pain.
mm,
That's when I saw her because what can happen for if the audience doesn't know it, the pain can start to move around
mhm,
body. So she started actually having, I think it was either one-sided or bilateral knee pain.
mhm,
The doctor said the same thing. Yeah, your MRI shows you've got degeneration in your knees. And I was like, wait a second, let me hear your story. So when you hear the story, you understand it. When your eyes are open to look for stress now as a potential causative factor, you're not just looking at the body anymore. So
mhm,
she went on to get over her knee pain without any surgery,
mhm.
completely back to doing her Zumba and everything else. She probably didn't need the neck surgery, is my guess,
Right.
but she had it.
Yeah.
But yeah, those are some stories of what can happen, and many, many more of things like that.
Yeah. Do you have any advice for someone who's just starting out?
Yeah, I would say, look, you open your mind. to this possibility. Most people I see have already been to many doctors. I'm sure you're the same way, right? They've been to
Mm-hmm.
many practitioners. If you're one of these people who have been treated left and right and have gotten reports back, and either the doctor says, we're not sure what's wrong with you, or they even tell you, oh, you've got this wrong in your spine, let's say, or you've got this issue, but you've had all these treatments and it's not getting better. And you can look at the psychological side. You can start asking yourself again, was there stress at the time this started? Do you have a history of life stress? Did you go through some childhood adversity, trauma, PTSD? Do you have a history of anxiety or depression? Are you a person who's worrying all the time, catastrophizes?
Mm-hmm.
Are you somebody who holds in your emotions? You tend to keep your emotions in. So there's these type of things. There's also what we call personality traits that
Mm-hmm.
Dr. Sarno was really amazing, I think, to really distinguish these. That there's certain personality types that are more prone to this. And as you know, right, the people pleaser, the really kind, overly kind, conscientious person, the perfectionistic person, the
Mm-hmm.
goodist, the do-gooder. Um,
Mm-hmm.
People put other people first, right? So we're looking for some of these psychological variables, and you want to ask yourself and look at your whole history because remember, your brain is right there. It's not cut off from your body. It's wired
Mm-hmm.
up into your body through your nervous system, and there's a two-way street.
Mm-hmm.
And when people ask me, they say, "Well, I don't believe that, Jim. That's not. How can we have that? Why isn't the doctor?" I said, "Well, one, they're not trained in this. We haven't integrated that yet. But if you want to see how this works, think of an amputee. I like to use that example. And I'll say it again right now. How does an amputee have pain in a foot that's not there anymore? How can they say there's a pain there that's debilitating, sometimes 10 out of 10, and they
Mm-hmm.
don't even have the body part anymore?
Mm-hmm.
That proves to you that your brain can cause pain in your
Yeah.
body, right?
Yeah. Yeah. Such a good example. What would you advise people who've been at this for a while and maybe are frustrated that it's not working for them or that they haven't gotten healed as fast as other people?
Yeah, it's a good question. I tell people there's no timeline when
Mhm.
I meet them. There's no timeline because this isn't like normal healing where you say up 6 to 8 weeks.
Yeah.
We don't know. There's lots of variable factors here. You know, again, the history of the person,
Hmm.
how they're approaching their work, the mind body work.
Hmm.
Um, do they have current life stress still? Is there some different factors taking place? Maybe they've been through pretty severe trauma. I see a lot of people with that where their nervous system is really highly dysregulated,
Hmm.
right? And so it's going to take them, it may take them a bit longer, but I don't like to put any timeline on it because I have seen people get better pretty fast. And I talked to a lady today, I think it was, I hadn't seen her since 2020. So it's
Hmm.
been 4 years. And
Hmm.
it's taking her, she said, I'm 80% better now. It's
Hmm.
taken her that long,
Hmm.
severe facial pain. And she's like, I still got a bit left to go. And we talked through some things, but so there's really no timeline. It can be fast, it can be slow, it can be medium. And what I would say is just don't give up on the process. Don't stop. It can take time to retrain your brain to really shift it into
Hmm.
a different state. Um, and there, like I said, there's different factors at play here, but don't give up on it. The people I see who continue with it and they stay consistent and persistent, they typically find success at the end of the day.
Yeah. Yeah. That is a good point. Yeah, because I think sometimes people we have that perfectionistic tendency. We want to do it quickly and perfectly and right the first time. We want to be the best healer, and sometimes that can be to our own detriment. And so the process is not always just linear and easy, even though it's simple. The concept is simple of decreasing fear, decreasing that alarm mechanism, but
Yeah. And
there's
it can spike up. We have these pathways that can go quiet basically, and then we feel better and something could trigger them again. So
yes.
it can be a bit of up and down for people. One of the patterns I see a lot is somebody starts to get really better and get a breakthrough, and then if soon after follows with the big hit of more symptoms or an uptick in symptoms. And so
Yes.
we see that a lot because the pattern in the brain and returns. It's like it's something somebody's learned. It
Yes.
doesn't just drop off right away. It returns again.
Yes.
That's the program or pattern running in their system. So we have to work through different levels of it, iterations of it, sometimes many times to finally get the brain to settle down.
Yeah. And that can be sometimes difficult, right? When people come to you and they're like, "Hey, now I have this new symptom, and I think it's because I was playing pickleball, and I think, that MCL is flaring up again, and it's my, and then they're, pretty convinced it's a new injury, right? But it's also happens to coincide with that time that, like you said, there's those extinction bursts when we start to feel better, or Sarno called it the symptom imperative. It's actually pretty normal as a
Yeah.
reminder, because sometimes people have heard it so many times and still forget. It's really normal when you start to feel better at first, especially that your body, can throw in a new symptom or an old one again.
Yeah, that's right. And remember the premise here, I think that we're taking, how much maybe you can share too how you take your approach, but the approach is really that it's a danger threat. Like that's the underlying, there's some danger threat in the brain, not in
Mm-hmm.
the body. So when the
Mm-hmm.
brain feels threatened or unsafe or insecure, it's going to kick this out as a way to let you know,
Mm-hmm.
to know something's up. Again, we go to the body. Oh no, something's wrong with my knee, like you said. That's where
Mm-hmm.
everybody goes. But ask yourself a simple question. Did I do something right now, or did I injure my knee? Did I do something that warrants it being an injury? Like, right,
Mm-hmm.
as a physical therapist, we can say, yeah, you had a grade 1, 2, or 3 sprain. You have to do something. You have to injure yourself to have that. So
Yeah.
I would ask
Yeah.
myself that a lot too as a PT, because I would get different types of stuff too. I say, Jim, did you do anything? Does this make sense? And I'd be like,
Mm-hmm.
no, I don't think so.
Mm-hmm.
I don't think it's physical. And many, many times this stuff goes away.
Mm-hmm.
It's not physical. It is the brain
Mm-hmm.
protecting or being sensitive and reacting or being stressed and, kicking this out. So there's
Yeah.
reasons.
And sometimes it can time it with, I remember picking up an empty cooler once
Yeah.
and my back pain, flared also during a stressful time. And I remember, by then I'd been doing this work several years. So I was like, oh, this is not about how I lifted up the cooler and that the cooler was too heavy and that my back is so weak and then my abs are weak. It's just, this is just, I'm feeling unsupported in my life right now or whatever. I felt like
Yeah.
it was more of an emotional thing, but your brain can time it with a physical thing. You're playing pickleball and your elbow starts hurting. And I had a
Yes.
really cool story from a client who'd had IVs in that arm, from a medical thing years ago. And her tennis elbow, pickleball elbow, just never ever went away. And then finally, when she realized, oh, it's like the anniversary of this kidney transplant where I
Yes.
had all these
Uh,
IVs blowing out this arm. And she even imagined ripping them out of her arm, when she would feel that pain. And
yeah.
then the pain went away and she could play pickleball. Like it's
Isn't that
crazy kind
amazing?
of stuff. Yeah.
Something like that, where remember, and the other thing I want to say, it's unconscious. A lot of times, this is your unconscious mind.
Yes.
It's not your conscious mind. And I see a lot of
Yes.
people who consciously feel one way, but the limbic brain, the unconscious brain feels another way.
Yes.
Things like an anniversary, a simple thought, that part of your nervous system is always scanning and trying to protect you. So it's picking up information from your environment, from
Yes.
your own body. And so many times it will react as if there's something wrong, and there's
Yes.
absolutely nothing wrong.
Yes.
So we
Yeah.
have to really dig deep to decipher what's going
Yeah.
on here.
And I don't know if you've seen this with coaching, but it blows my mind. Sometimes I'll coach with someone and we're like 40 minutes in, and all of a sudden they remember, oh, yeah, my very best friend's husband was diagnosed with cancer and given 3 months to live. That has been stressing me out. And I've been worrying about my husband. And it's like they almost dissociate from it or just kind of like compartmentalize. I don't know what I'm just using big words, but I don't know what the real term is, but hide it. I mean, the subconscious, like you said, it's not really in the awareness of the conscious mind, even though you may know, oh, yeah, this stressful thing is happening. When I just
Yes.
ask you point blank, you might not even think of it.
No, it's a lot of times it's hidden. We got to be aware. We can try to make connections. It's when you see it clearly, it really helps. But just realize that brain is always, it has your whole life stored in it. And anything that's in rhyming or in resonance with something that happened to you, even if it's like completely seems so out there, if the brain thinks it's somehow related to something that happened to you or is threatening, it
Mm-hmm.
can kick up. I just had I'm thinking of a patient now, this was a few years ago, who had chronic back pain for 2 years. And what happened was her husband had cheated on her. And
Mm.
so started the back pain.
Mm-hmm.
And she got over that. She got the relationship was back on good footing. It worked through some stuff. She was fine.
Mm-hmm.
One day her neighbor comes over and confides in her that she thinks her husband's cheating on her.
Mm-hmm.
There's up her back pain again. Her back pain
Oh,
started up
wow.
again.
Mm-hmm.
Incredible stories. I'll give you one more of a lady. This is even more dramatic, who was cleaning her bathroom one day, which she had cleaned many times before. And there was some smell in her bathroom, for whatever reason, this time created this weird facial pain around her nose and face. She felt like she was couldn't breathe and she had this weird sensations there. And it turned out when we were going through her history, she remembered, just like your client did, that when she was 5 years old, she had her tonsils taken out and they put a mask on her and she couldn't breathe. She felt like she was suffocating. And
Whoa.
that smell that she had back when she was 5, the one she had now, reminded her brain of that and started the symptom. So
Whoa.
pretty dramatic.
Yeah.
Not always
Yeah.
like that, but that just
Yeah.
tells you how powerful our brains are.
Yes.
That it can, and it can do it years later,
Mm-hmm.
even when you logically know everything is fine.
Mm-hmm.
One last story: a guy who used to go to work on Mondays, and he had to take an airplane. He worked for the IRS, and he had to go audit businesses, and he absolutely was terrified of flying. He hated flying. And when I saw him, I was treating for his foot pain. And he said, God, I don't know, every Sunday night, this pain is just so much worse.
Mm-hmm.
He never put that together. And he had been retired for 10 years.
Oh my
Right. So he
gosh.
wasn't even working. But his
Whoa.
brain was still worried that he would go get on a plane Monday morning, potentially.
Mm-hmm.
His unconscious.
His unconscious brain below his conscious awareness. Yeah. Yeah, exactly. And so it
Pretty
just,
incredible.
yeah, a lot of times it takes someone else or, some pretty deep work to start to recognize those patterns and to start to see. But once you see it, it's hard to unsee it, right? You start to see it everywhere. And have you ever been surprised with some symptoms? Like I can think of one lady, actually the same one with the arm thing. She was starting to get a sore throat one day, and we
Mm-hmm.
coached and we did some somatic stuff, and her sore throat went away. So have you
Mm-hmm.
ever like had some non-traditional ones that have surprised you? You're like, well, we might as well, we're on the call, we might as well coach on it, and it's been
Yeah, I
surprising.
mean, let's see, all sorts of stuff have gone away, and people like all different kinds of weird symptoms. I'm trying to think of facial pain, weird facial pains
Mm-hmm.
gone away, weird intestinal symptoms,
Mm-hmm.
just really strange things that some people
Mm-hmm.
have can disappear. I had a lady once in Australia who, I forget, she had some kind of weird pain in her stitch in her side,
Mm-hmm.
and it was a recent pain. It came on. So it wasn't even chronic, but she
Mm-hmm.
knew about this work. And she says, yeah, I think this pain, I think what happened was at work, I have a boss who I don't like. She really pissed me off. And I noticed I started to develop a pain there today. And I wasn't able to say anything to her. So we just had her go through a simple, this is more about emotions, have her go through a simple emotional expression exercise of what she wanted to say to the boss and release that. And her pain went away just in the moment and never came
Amazing.
back. So
Yeah.
sometimes you can see that.
Yeah.
Not
Yeah.
always the case. I don't want to paint that picture for everybody, but
Sure. Yeah.
be like
I
that.
like to talk about it just to, I think a lot of people have heard of some of the traditional things, body pains and maybe some types of nerve pain, but maybe not others. It's almost like people think that, some symptoms couldn't be caused by the brain, but
Yeah,
I was
any
thinking, yeah,
symptom like
any
burning mouth,
burning mouth.
you
Yeah.
know, all sorts of weird dizziness, chronic fatigue,
Yes.
um,
Hmm.
zaps, jolts in the body,
Yep.
testicular pain. pelvic pain,
Mm-hmm.
all sorts of issues there, rashes. I've seen people change from one lady from a migraine to full blown body rashes all over herself,
Yeah.
red rashes. One lady went to the
Rashes.
hospital over them. Um,
Mm-hmm.
I've seen gastric pain that's so severe. I mean, it's incredible what you can see. And again, the triggers that can happen can sometimes be something so benign that it appears to be so ridiculous. Like I had two people go to the ER, one guy because he was taking a trip to Las Vegas for a bachelor party, which sounds awesome, right? Oh, great. But he was worried about leaving his family home.
Mm.
And
Yeah.
so he developed a crippling back pain and then he couldn't go
Oh,
in
yeah.
the ER.
Yeah.
Things like this, it's little triggers, and it's just incredible to hear these stories.
Yeah. I like to think of there's this concept that it's easier for us to get sympathy for a physical pain than for an emotional one.
Yeah.
And and that could be some way of explaining it. I was also going to say along the lines of those like weird stories, there was someone with even like a functional movement disorder, like, well, in the sense she would go upstairs and it would clunk every time she would go upstairs. So, she was told something about her meniscus. And
Hmm.
so just for fun, we did a visualization and she visualized herself going up and it being pain-free and it not having that sound, and it's easy and she's grateful and she's happy and she's smiling in real life. And then she goes and tests it and she walked upstairs and it didn't clunk. So
Dink clunk. Isn't that
even just
amazing?
doing like a little 2-minute visualization changed
Yeah.
this physical movement pattern that
Yeah.
she was pretty convinced was because she had this torn meniscus and it was clicking, but it was probably how she was guarding and tensing to keep it
Yes.
safe,
Protecting.
right? Protecting and causing actually that clunking to happen.
Yeah, that's awesome. I tell people, don't underestimate the power of your brain. Fear, for example, is one emotion, which will anxiety is a really powerful producer of physical symptoms. And that's an example of you gave there. They did a study on women walking upstairs, actually,
Hmm.
57 women with knee pain. And they actually measured what was more likely to cause a knee pain, the compression on the knee joint, which you would logically think, yeah, probably you're walking upstairs, or what's called kinesiophobia, which is a fear of walking up the stairs. And
Mm.
what they found that the kinesiophobia was moderately to largely associated with the pain, and the knee forces were not. It's in
Whoa.
alignment with what you're saying that
Oh.
fear causes these things. We don't believe this, but it's
Mm-hmm.
absolutely true.
I remember a similar study with stiffness in the back, and what most likely caused stiffness in the back was kinesiophobia, that fear of movement, right? So
Yeah,
rather than, the pain causing the stiffness, it's actually the fear of the pain that causes you to be stiff, which actually causes pain.
that's right. Yeah,
Yeah.
so these emotions, again, can cause these very real physiological changes. It's not far-fetched, right? Emotions create feelings, emotions travel through your nervous system. Think of a panic attack. A person has a lot of physical changes going on, right?
Yeah.
So we have these changes that happen, and muscles tense, muscles tighten, they guard, they protect. So of course you can have pain or some type of symptom when you're having high emotion.
Yes, exactly. I even use the example of how when you're sitting next to a car that moves, you feel like you're physically moving. Like you really can feel physically things going on in your body that aren't reality because of what your brain perceives.
Yeah. Yeah, it's really trippy. It's really interesting. It's really fascinating. And when like you've sensed it early, once your eyes are open to it, you see it. And hopefully your audience can take from this too that look, go a step deeper, really think about, really explore that it's not just your body. It's
Mhm.
really not, especially if it's not going away. It's probably
Mhm.
not your body. It's probably something more nervous system and brain related. So explore that.
Yes, yes, absolutely. Well, I think this is the right audience for that. They probably already know where to find you, but if they don't, do you want to just share where they can find you and more of your resources?
Yeah, thanks. They can find me at the painpt.com website. I have a YouTube channel as well called the Pain PT.
Mhm.
You can go there and get more information if you want. So yeah, if anybody's looking for help, I'm out there.
Awesome. Yeah, I think you also have a somatic tracking meditation. That's a pretty popular one. I have one too, and I think it's my most downloaded episode. So,
Yeah.
but I know people have been like, "That's the somatic tracking guy." So,
Yeah,
um,
it's funny how one video can kind of go
mhm.
viral or it become more the one people have. And that one is interesting. What I'll share about that recording of that video
Oh
because
yeah, I
I
love the little
did it
behind
on
the
a whim.
scenes.
I did it literally sitting down,
Wow.
first take in 10 minutes. I didn't think what I was going to say. I had no script.
Nice.
I sat down to do it. In fact, in the back half of the video, my wife's in the kitchen moving some pots around, and that's what got into there
Oh my gosh.
for the recording. So that was pretty funny.
That is funny. I love that. It's just kind of like it sounds like it just flowed out of you and it was very aligned
Yeah, and that
and
became
easy.
again yeah, popular, just like yours, a popular video. And I think people go to this, right? I mean, they're looking for some resources with somatic tracking or pain reprocessing therapy.
Mhm.
And I think it is really helpful for people.
Yeah, yeah, and that is like one of the best first tips for people is try that somatic tracking, which is basically mindfully describing your symptoms with different words and is very calming and also can create those brain changes that we were talking about. Not just calming in the moment for a few seconds, which it can be, but also like creating lasting change.
Yeah. Yeah,
Yeah.
absolutely. Yeah, there's a wealth of stuff coming out. There's more coming out, right, in terms of trying to understand our brains and how to work with them. But we're really trying to create safety in the brain. I think that's the really key here to create security and safety, that we can relax, we can let go, we can express emotions, we can move forward, right, in knowing we're not broken, our body is okay. Like all these things are super important, I think, in helping people to recover.
Yes, absolutely. I agree 100%. I'm glad you're out there spreading the word, doing this work, helping people in this way. I find it so much more rewarding and effective than traditional physical therapy, which I did love. I loved that too. That was very rewarding. But this, it's just, it feels like it's just this lasting change. It's something that people can take with them and apply the whole rest of their life.
Yeah, yeah, it's amazing. I'm so glad you're doing the work as well. And there's not too many of us PTs, and Charlie, there's a few others, but that have transitioned into doing this more full time. So that's
Hmm.
really cool that you're doing it. I think it's what is much needed, much needed.
Yeah, yeah, absolutely. All right. Well, thanks again for joining us. I'm sure we'll talk again sometime soon. Take care.
Okay, great to
Bye.
talk to you today, Betsy. Bye bye.
Thank you. Bye-bye.
Thank you so much for listening. I hope you learned a little bit about your brain today that helps you in your life like it helped me. Please be sure and subscribe and leave a review. And of course, be sure and share this podcast with someone you know that wants an unstoppable body and mind.